Hi, my name is Ron Ivins, and in June 2011, I was diagnosed with stage 4 inoperable pancreatic cancer. And so when I say today that I'm glad to be here, I really mean I'm glad to be here. My treatment started in July of last year when I went to another cancer center whose name rhymes with Sloan Kettering. And while I was there, I was put on Fluranox to begin with. And as Dr. Fine talked about the toxicity, he really means it was very toxic. I had days where I used to call it to my wife that it was a day you can't get your head off the pillow. And you would have days like that in a row where you just lie in bed and you really couldn't do much else. One of the other side effects of it was you couldn't drink anything that was colder than room temperature. And even room temperature sometimes caused a lot of problems. And your neck would vibrate, and you'd have a lot of pain from it. And, you know, in the middle of the summer, drinking warm apple juice is not very pleasant. And on top of that, it didn't work. So 3 months later, I was getting more pain. The cancer was progressing, and they changed over to a GTX regimen. And that was in September of 2011. And it was really a changing moment in my life. I was able to go back to work part-time, the tumor shrunk, and I was feeling much, much better. And then we come to June of 2012, where the latest CAT scan showed that the GTX wasn't working anymore. And I was at Sloan Kettering, and which is, I believe to be a fine cancer hospital, but their attitude at that time was, it's not working. Go find some clinical trials on your own, and there's nothing we can do for you. And they sort of left me high and dry. And then due to the efforts of my wife and my daughter Julie, they scoured around to try and find different clinical trials. And we went and spoke to different people, and we came to New-York-Presbyterian and Dr. Fine, and Dr. Fine says, well, I could put you in a clinical trial, but I think I could help you with just normal chemotherapy treatment. And he took the GTX, and he made a couple of twists to it, and my latest CAT scan showed that some of the tumors are shrinking. And I'm still here, and I'm feeling fine. And I tried to make arrangements that after 3 treatments, of which I have over a 9-week period, because I have 2 weeks of chemo on and 1 week of off, I try to go away during the break that I have when we have to go off the chemo to take the CAT scans. And so this has been a pretty busy year for me, because I've never gone away so much as I have this year. And, and cruises are nice, But, I think, the change in the treatment and the medicines they've gotten here, and the attitude and the feeling that you have here from everybody that works here and the staff makes a difference. Because, while the problem is in your pancreas, the problem is also in your head and in your heart and the people around you. And, I've been lucky enough this past year to see my oldest daughter, Julie, and her husband, Mike, buy a house. And my daughter, who was living in London, came home from London and brought with her my new son-in-law, Grant. And I was able to dance at their wedding. And it's a wonderful thing. And I'm looking to stay on the GTX and maybe move on to the GAX or the XYZ or whatever they have here that will just keep me going. And that's what it's all about. You know, your family is what's important, and that's how you keep on going.